Welcome back. A new state law now requires public schools to obtain written consent from parents before providing health services. Well, has many parents confused and often leave school nurses scrambling to try to get that consent in order to be able to treat students. Our Natalia Osuna is here live in the studio to break it all down for us. Natalia?
Mike, well, the Texas Education Agency is now updating their guidance on the bill, saying the key lies in understanding the difference between health care and health-related services. The first requires school nurses have that parental consent, while the second does not. I spoke with Robstown ISD nurses and social workers who break it down.
Nurses for years since schools opened have always done vision, hearing, scoliosis.
But now a new state law requiring parents in Texas to sign consent forms for their kids to receive health care from school nurses has changed that. It's a move Melissa Chavez with Robstown ISD says has caused some confusion among parents and staff.
It's just understood that us as nurses in the school setting would be able to treat the students and take care of them and assess them for that, and then of course call the parents, but now it's a required consent upon enrollment.
Once Senate Bill 12 went into effect on September 1st, school nurses across the state are now scrambling to collect parents' consent forms to be able to give students basic health care services. Confusion over the law's wording has legislators asking the Texas Education Agency to change the bill's guidance to differentiate between health-related and health care services.
Health-related is something anyone can do, an adult, a nurse can assess, such as providing a change of clothes, wiping a bloody nose, looking at the throat, things like that.
Chavez says health care services are more invasive.
Child gets hurt in a playground, then we're providing a different type of services because we are the ones who are able to assess it and determine if it needs steri strips, if it needs, if we need to call EMS, if we need to do, the screenings or other services that we do, giving medications as well. Those require consents.
District social worker Christian De Leon adds these consent forms also apply for mental health services.
Any kind of psychological examinations or what can be considered psychological examinations. Sometimes if a student appears to be in crisis, to provide that screening to ensure safety.
At the end of the day, district leaders say they want parents and guardians to be well informed.
We want our students to know that parents and the school are working together.
And well, the nursing staff at Robstown ISD tell me that in a moment of crisis, they would be able to help a student as licensed nurses in Texas. But now they're reaching out to parents who've selected no to consent forms to make sure they clearly understand what they're saying no to. We'll keep you updated, but for now, Mike, back to you.